In this video by deckplate we will understand the VA rating for tinnitus, otitis media, peripheral vestibular disorder, otitis externa, and otosclerosis. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. When it comes to receiving benefits from the Department of Veterans Affairs for ear-related conditions, understanding the intricate rating system is crucial. Whether it's chronic suppurative otitis media, peripheral vestibular disorders, or tinnitus, each condition is assessed based on specific criteria outlined by the VA. Let's delve into the details of these conditions and the corresponding VA ratings. Chronic suppurative otitis media, mastoiditis, or cholesteatoma, diagnostic code, 6200. This category encompasses conditions involving chronic ear infections, mastoiditis, or the presence of cholesteatoma. During periods of suppuration, discharge, or with the presence of oral polyps, a rating of 10% is typically assigned. It's essential to evaluate associated complications such as hearing impairment, labyrinthitis, tinnitus, facial nerve paralysis, or bone loss of the skull separately. Chronic non-suppurative otitis media with effusion, diagnostic code, 6201. Chronic non-suppurative otitis media refers to a condition with persistent middle ear fluid buildup, often termed serous otitis media. The rating is based on the degree of hearing impairment caused by the condition. Peripheral vestibular disorders, diagnostic code, 6204. Peripheral vestibular disorders result in symptoms such as dizziness and occasional staggering. Depending on the severity and frequency of these symptoms, ratings range from 10% for occasional dizziness to 30% for more severe and frequent manifestations. Objective findings supporting the diagnosis are crucial for determining compensable evaluations under this code. Chronic otitis externa, diagnostic code, 6210. Chronic otitis externa involves inflammation of the external ear canal, characterized by swelling, dry and scaly skin, serous discharge, and itching necessitating frequent and prolonged treatment. A rating of 10% is assigned based on the severity and chronicity of symptoms. Tinnitus, recurrent, diagnostic code, 6260. Tinnitus, the perception of noise or ringing in the ears, can be a debilitating condition for many veterans. Recurrent tinnitus is evaluated separately and carries a standard rating of 10%. It's important to note that a separate evaluation for tinnitus may be combined with other diagnostic codes, except when tinnitus supports an evaluation under one of those codes. Assign only a single evaluation for recurrent tinnitus, whether the sound is perceived in one ear, both ears, or in the head. Do not evaluate objective tinnitus, in which the sound is audible to other people and has a definable cause that may or may not be pathologic, under this diagnostic code, but evaluated as part of any underlying condition causing it. Navigating the VA rating system for ear conditions requires a comprehensive understanding of the specific criteria outlined for each condition. By familiarizing yourself with the guidelines provided by the VA, veterans can ensure they receive the appropriate compensation for their service-related ear conditions. Thank you for watching this video. Please don't forget to subscribe and like our videos.